Once your dentist has identified the infection inside your tooth, you may be wondering what other options you have besides getting a root canal. The first is to do nothing. However, if the bacteria is not removed, it will work its way to the tip of the root and eventually into your bone. Once it does, it will cause an abscess and infection. Obviously, this course of action or inaction is not recommended. Your second choice is to extract or remove the tooth. Be aware if you simply extract the tooth, the space caused by the missing tooth will cause the surrounding teeth to shift into that space. This shift could cause a misalignment in your mouth that can result in problems with your jaw. In addition, these shifted teeth are harder to clean, making them more susceptible to gum disease, decay, or even additional tooth loss. If you do elect to pull the tooth, your best plan would be to replace it with a dental appliance, such as an implant or a bridge. This, of course, would add more expense to the treatment in addition to the loss of your tooth.